In the previous lecture, we discussed about the narrow spectrum penicillin antibiotics. In that, we have the two examples, penicillin G and penicillin V. They have they were effective against the most of the gram-positive bacteria, and because of bigger size, they had a narrow spectrum. We found that there is a bacteria Staphylococcus aureus that was produced beta-lactamase. Due to the production of beta-lactamase, natural penicillins were not effective against that bacteria. Then later on, we provided modifications in the natural penicillins, and modifications were that increase the size of the side chain. Because of that increase in the side chain, we could prevented uh, those natural penicillins from the attack of the beta-lactamase. Hence, by the modification of those natural penicillins, we discovered new class of the penicillin antibiotics that had very narrow spectrum penicillins, and that very narrow spectrum was achieved due to the modification in their side chain by increasing their side chain. So these penicillins are also known as anti-staphylococcus penicillins. So here I can tell you, anti-staphylococcus penicillin is a group of penicillins developed specifically to combat penicillin producing Staphylococcus aureus bacteria by being resistant to beta-lactamases enzyme. They achieve this resistance primarily due to their bulky side chains, increased side chain length, which prevent beta-lactamases from binding and hydrolyzing their beta-lactam ring. Examples of these penicillins include methicillin, neficillin, oxacillin, and cloxacillin. Here I can tell you, as I discussed, these are the anti-staphylococcal penicillins. Why we are saying them anti-staphylococcal? Because they are active against the Staphylococcus aureus. Previously, natural penicillins were not effective, but by the modification, as we provided modification, then those modifications increase in the side chain length, which prevented beta-lactamase from the binding and hydrolyzing their beta-lactam rings. So here is its explanation. These antibiotics work by covalently binding to the penicillin binding proteins. As I have told you, penicillin binding proteins are the sites where penicillin antibiotics bind and produce their action. These antibiotics work by binding covalently to the penicillin binding proteins in the bacterial cell wall, inhibiting the transpeptidation reaction necessary for the peptidoglycan synthesis, leading to the bacterial cell death. This is the mechanism of the penicillin antibiotics. They are effective primarily against methicillin sensitive Staphylococcus aureus. So, as I have already told you, they are active against the Staphylococcus. So, they are effective against the methicillin sensitive Staphylococcus aureus, and are often used to treat skin and soft tissue infections as well as serious staphylococcal infections like endocarditis and osteomyelitis. So here they have told that those penicillins such as methicillins, neficillins, oxacillins, and cloxacillins, they are the narrow spectrum penicillin antibiotics. They are active against the methicillin Staphylococcus aureus, and they are used to treat skin and soft skin tissues and osteomyelitis. Osteomyelitis means there is the inflammation of the bone and there is the bone problems. Endocarditis means inflammation of the inner layer of the heart vessels. So they are used for such severe infections, and as they are resistant to beta-lactamase, they are found to be useful in these conditions. However, they are ineffective against the methicillin resistant Staphylococcus aureus. Staphylococcus aureus have two types. Means this microbe can be methicillin resistant and it can be methicillin sensitive. Very narrow spectrum penicillin antibiotics are effective against the penicillin sensitive Staphylococcus aureus, while they are not active against the methicillin resistant Staphylococcus aureus MRSA. Because why they are not active against the MRSA? MRSA produce altered protein binding sites. As in the above paragraph, I told you that these antibiotics bind with the penicillin binding proteins. As MRSA has the ability to produce altered PVPs, इनकी जो PVPs होती हैं, they are become changed, which reduce the binding affinity and effectiveness of these antibiotics. Hence, because of the change in the protein binding sites, they are unable to bind with the MRSA, and in this way MRSA produces resistance against the very narrow spectrum antibiotics. Methicillin was the first developed but now is rarely used due to adverse effects. Methicillin and oxycillin remain commonly used clinically. Methicillin and oxycillin remain commonly used clinically, often given intravenously for systemic infections, while oral forms like cloxacillin and dicloxacillin are used for the mild infections.